Thank you so much for having me. Thank you, Leslie, for arranging it. And I don't know how you guys manage, but I feel like we're the least controversial group here today. But in all honesty, we're here to talk about Lyme disease, and each and every one of us has a reason to be here. Whether you are the one who's suffering from it, or you have family members that you're supporting, or you're a healthcare professional who is treating Lyme, we're obviously all affected by it. We no longer are able to ignore this pandemic because there are millions of people in this country and around the world who are suffering, and it's now becoming really a human rights issue. We are actually not here to talk about the Lyme disease that can cause a little headache, or the Lyme disease that cause a little joint pain, or some fevers, or a little fatigue, or a rash. We're not here to talk about the Lyme disease that gets treated and cured in 2 to 3 weeks, or better yet, treated and cured without any medication or treatment at all. We're actually here to talk about the Lyme disease that can cause a collection of infections, unrelenting inflammation throughout your body, and an abnormal immune response that's taxing on your immune system and often develops an autoimmune phenomenon. So it's really a collection of infections, inflammation, and an autoimmune response that can cause the Lyme disease that we're here talking about today. Unreliable testing that provide false sense of security to both patients and physicians, as well as low level of suspicion and understanding of the complexity of the disease, makes it very difficult to diagnose and difficult to treat. Most Canadians come to their physicians with late-stage symptoms when it can present and mimic multiple neurologic and other conditions. And specifically, since I'm a neurologist, I'd like to touch on a few of the neurologic symptoms. So neurodevelopmental problems in children ages 5 to 14, who are one of the most affected groups in this population, which is learning disabilities, autism-type symptoms, behavioral problems, and the explosion of ADD and ADHD across the world. I'm saying that a significant portion of these people most likely have infections and an infection-induced autoimmune encephalitis that's causing these symptoms, and therefore needs to be treated not symptomatically, but treated with the underlying medical problem. Neurodegenerative disorders that you've all known and heard of, MS, ALS, Parkinson's disease, Alzheimer's, and various dementias. We've had an explosion of Alzheimer's and dementias in the last 30 to 40 years in North America. Why is that going on? Perhaps not 100% of these patients have infections, but a significant part of them do. And is it even possible to consider that potentially these conditions can be reversible? Neuropsychiatric problems such as anxiety, depression, paranoia, mood disorders, thought disorders. 1 of 5 people across the world are on psychotropic medications. Recent studies come out saying that up to 50% of patients who have in-hospital psychiatric hospitalizations have autoimmune disorders, and infections-induced autoimmune encephalitis can trigger that. Of course, as well as various other neuropathies, pain syndromes, and involvement of other organ systems that were talked about here today. Talking about better testing and treatment is very, very important. But what change can we bring on to start today and right now? Well, we have to talk about protection. Protecting your yard, 90% of patients get an insect bite in doing such high-risk activity as playing in their yard. So you need to protect your yard. You need to protect your pets, not only so that they don't get Lyme disease, but they can carry these insects into your home, and you need to protect your family from them. And of course, protecting yourselves. As someone else mentioned, I am also on social media raising awareness through Facebook, Instagram, and Twitter. And you can go to my website, elenafridmd.com, to learn more about protection, where it has a lot of good information and websites that are educational. Early detection is key for this disease. Start thinking a systemic illness in someone who has developed multiple odd symptoms that are puzzling their physician and is very difficult to treat with mainstream medical protocols. Second, know that the testing is unreliable, and so the healthcare professional should be relying more on history taking and their clinical judgment, just like in the olden days. Recheck your test. So recheck your tests because, as we all know, just because you tested negative doesn't mean that you don't have Lyme disease, and often retesting may provide more information to the physician and to the patient. And when in doubt, treat. Because if we start waiting for late-stage symptoms, such as neurologic, cardiologic, and beyond, often treatment can be very complicated and very prolonged. Like I said at the beginning of my talk, this is a human rights issue. There are millions of people who are suffering and in pain in this country and around the world. And in the words of Dr. Charles Ray Jones, who says, if we continue to ignore this pandemic, we will create a generation of people who will never achieve their genetic potential and will become a burden to the state. Now that you all know this, it is each and every one of our responsibility to educate those around us and call for change. Thank you so much.